I want to start with a sensory memory. I guarantee pretty much everyone listening has experienced this.
Okay.
You're in a clinical room, fluorescent lights.
Mm-hmm.
You're sitting on that paper that, crinkles every single time you move.
Oh, I know exactly where this is going.
Right. Your knee hurts or maybe your shoulder's locked up. And the physical therapist walks in, they wheel over this cart with a device that looks like, 1990s computer equipment.
And it's attached to that wand with the metal head?
Yes. And then the cold gel.
It's arguably the most distinct sensation in all of physical therapy, that cold gel shock.
It is. They slather it on, and then for the next 8 to 10 minutes, they just rub this metal circle over your skin.
Mm-hmm. It
gets a little warm. Maybe you feel a tiny vibration. But mostly you're just sitting there making awkward small talk while someone rubs a metal stick on your injury.
Mm.
And I have to admit, I've sat there thinking, is this actually doing anything?
Or is it just a very expensive tech-assisted massage?
Exactly.
Yeah.
To make me feel like I'm getting treatment.
You are definitely not the only one asking that. I mean, that is the classic skepticism around therapeutic ultrasound. It's been a staple in clinics for, 50, 60 years?
Wow, that long.
Oh, yeah. But the gap between we've always done it this way and here's the hard data that proves it works, well, that gap can sometimes be uncomfortably wide.
And that is exactly why we're digging into this today. We're looking at a comprehensive evidence-based review from Physio Hub.
Right.
They really did the heavy lifting, analyzing the efficacy of ultrasound therapy for both athletes and general patients. And I was surprised by the nuance. It's not just it works or it's a scam.
It never is that simple, is it?
No. It turns out the answer depends entirely on what you're trying to fix and, more importantly, the specific frequency you are tuning into.
That is the key. We tend to lump ultrasound into one big bucket, but physiologically, the difference between the settings and the type of ultrasound can be the difference between just heating a tissue and actually signaling a cell to rebuild itself.
Okay, so let's get the basics on the table. When that wand is on my shoulder, we're dealing with high-frequency sound waves. But this doesn't sound like cranking the bass in your car.
No. These are frequencies way beyond human hearing. We're talking in the megahertz range.
Okay.
When those waves hit your skin, they travel through that conductive gel, which you need because sound waves just don't travel well through air.
Right.
And they penetrate the soft tissue.
And once they're inside, they create what the report calls mechanical vibrations. I kind of love that description. It's essentially just shaking the cells.
That's exactly what's happening at a microscopic level. The sound waves cause the molecules in your tissues to oscillate, to vibrate. And that vibration is the mechanism.
The goal being to influence, 3 things?
3 main things, yeah. Circulation, cellular activity, and tissue repair.
Okay, but here's where I want to get into the weeds. Because the Physio Hub report makes a massive deal about the mode of delivery.
The settings on the machine.
Right. I've had PTs tell me, okay, I'm going to set this to continuous to warm it up, or I'm setting this to pulse because it's inflamed. I was just nodded and assumed that was settled science.
It is certainly settled tradition.
Right. So looking at the mechanics here, continuous ultrasound is just what it sounds like. The machine's on a 100% duty cycle.
The sound waves are just hammering the tissue without any break. And the friction from that constant vibration creates thermal energy. It creates heat.
Deep in the tissue. So the logic has always been, if you have a stiff joint or chronic tightness, you blast it with continuous ultrasound to heat it up and loosen it.
Exactly.
Versus pulsed ultrasound, which is, it's more like a strobe light, right? On, off.
Yeah, that's a great analogy. It's usually a 20 or 50% duty cycle. It's happening so fast you don't feel the off moments.
And the benefit there is you get the vibration, the mechanical shaking, but without all that heat building up.
Precisely. That's the non-thermal approach. You'd use that for an acute injury, like a fresh ankle sprain where the area is already swollen and hot.
The last thing you want is more heat.
You don't want to add more heat to an inflammatory fire. So pulsed gives you the mechanical stimulation without the thermal risk.
See, that logic seems so sound, pun intended. It makes perfect intuitive sense. Heat for stiff stuff, pulsing for swollen stuff.
It does.
But this is where the Physio Hub review just throws a wrench in the gears. They looked at actual patient outcomes for really common conditions, specifically knee osteoarthritis and lateral epicondylitis, which is just a fancy name for tennis elbow.
2 of the most common reasons anyone ever walks into a PT clinic.
For sure. And they compared the results of using continuous versus pulsed ultrasound for these conditions. Well, The data was incredibly stubborn.
It didn't seem to matter which button the therapist pushed.
Right. It's a bit of a shock to the system for the purists, I imagine.
It really is. The review found that both groups improved. Pain went down, function went up, but there was no statistically significant difference between the group getting the heater setting and the group getting the strobe light setting.
That drives me crazy. How can the mechanism be so different? One is literally cooking the tissue, the other isn't, but the result is the same.
It suggests that for these, general musculoskeletal conditions, chronic knee pain, tendon irritation, the specific mode of the vibration is less important than we thought.
So, what is doing the work then?
Well, it might be that the general mechanical agitation is doing the heavy lifting, regardless of the thermal effect. Or, and we have to consider this, the improvement might be coming from the overall therapeutic context, not just the physics of the wave.
The dreaded placebo effect.
Not entirely placebo, but there is a huge psychological component to sitting with a clinician who is physically attending to your injury for 10 minutes. That ritual of care can reduce pain perception.
Okay, that makes sense.
But even looking at the biology, it just seems the body isn't as picky about the duty cycle as the textbook suggested.
There was one detail in the report that I found hilarious, though. The rat study.
Ah, yes. The muscle fibers.
They found that continuous ultrasound on rats actually increased muscle fiber size. Like they observed hypertrophy. So for a second, I'm thinking, wait, can I just sit on the couch and run an ultrasound wand over my biceps and get ripped?
I hate to crush your dreams, but no.
Oh, man.
The study did show a slight increase in muscle fiber diameter in the rats, which does imply that the thermal and mechanical stress triggered some kind of growth response. But, and this is the huge caveat, that microscopic change did not translate into a functional miracle.
The rats weren't suddenly bench pressing double their body weight.
Exactly. So we have this situation where the microscope sees a change, but the clinical reality is kind of,
Meh. Is a fair assessment for this specific debate then. The whole pulsed versus continuous thing.
Yeah. If you're treating general pain or stiffness, agonizing over the exact duty cycle might just be a waste of mental energy. The bottom line from the source is that for most general soft tissue issues, the mode matters much, much less than we were all taught.
This feels like the part of the deep dive where we tell the listeners, save your money, it's just a vibrating wand. But that would be premature.
Very premature.
Because while the general ultrasound stuff is a bit gray, there's a specific type of ultrasound in this report where the evidence is surprisingly rock solid.
This is the redemption arc of the episode. We have to talk about LIPUS.
LIPUS, low-intensity pulsed ultrasound. Now clarify this for me. Is this just turning the pulsed setting on the normal machine way down?
No, and that is a really common misconception. LIPUS is a distinct category. It uses a much lower intensity, lower power output, but the frequency and the pulsing are tuned very, very specifically. You typically won't find this on the standard combo unit in a basic clinic. This is often a standalone device used heavily in orthopedics.
And the list of benefits here reads like sci-fi compared to the general stuff. We aren't just talking about soothing pain anymore.
No, we're talking about biological construction.
This is what caught my eye. A significant reduction in recovery time for fractures. And not just fresh breaks, but non-unions, bones that have just stopped healing.
Which is an absolute nightmare scenario for a patient. Imagine you have a broken tibia, you're in a cast for months, and the x-ray shows the gap just isn't closing.
The body has basically given up.
It's given up on the repair. LIPUS is often the tool that restarts that engine.
But the report goes further than bone. It mentions angiogenesis. And I had to look this up to really grasp it. This is the formation of new blood vessels.
It is, and think about what that means. We aren't just heating tissue, we are stimulating the body to lay down new infrastructure, new highways for blood and oxygen.
And collagen synthesis. It improves the tensile strength of tendons. It boosts cell proliferation. This is the part where I need you to slow down and explain the how. Because with the general stuff, we said it's shaking the cells. But how does a shake tell a cell, hey, build a blood vessel right here?
That seems like a really complex instruction for a simple vibration.
It does.
It is complex, but it's fascinating. It all comes down to a concept called mechanotransduction.
Okay, unpack that. Mechanotransduction.
So imagine a single cell. It's not just a water balloon. It has an internal structure, a skeleton, called the cytoskeleton.
Right.
And poking out through the skin of the cell, the membrane, are these little receptors called integrins.
Integrins, got it.
Think of integrins like tiny mechanical switches or levers that stick out of the cell. They connect the inside of the cell to the outside world.
Okay.
When the specific acoustic pressure of the LIPUS wave hits that cell, it physically jostles these integrins. It literally pushes the lever.
So it's a physio trigger. It's like keying a command into a computer, but with a sound wave.
That's a perfect way to put it. The physical wave deforms the integrin, and that physical deformation triggers a chemical chain reaction inside the cell. It tells the nucleus to switch on specific genes.
That is wild. So the cell feels the sound wave, and it translates that physical feeling into a chemical command that says, time to release growth factors, or time to knit this bone together.
That is mechanotransduction in a nutshell, converting a mechanical force into chemical activity. And that is why LIPUS is so special. It's not about heat at all.
It's a signaling device, not a warming device.
Exactly. It's about hitting the right frequency to flip those very specific biological switches.
That completely changes how I view the technology. I mean, if you're just using it to warm up a sore back, it's a fancy heat pack. But if you're using LIPUS on a fracture, you're essentially hacking the cell's communication system to accelerate repair.
And that is why the clinical outcomes for LIPUS are so much stronger for tissue repair. You are engaging the biology, not just treating the symptom.
So we have this powerhouse technology. Why isn't it the cure for everything? If we can tell cells to build bone, why do we still have osteoporosis? Why can't we just scan our whole body and densify our skeletons?
Physics is the party pooper here.
Of course.
Ultrasound waves are sound, and sound gets absorbed and attenuated as it travels through tissue, through density.
It runs out of gas.
It runs out of gas rapidly. The deeper you go, the less energy actually arrives. The report specifically notes that for conditions like osteoporosis, which affects the deep lattice of the bone structure, often in the hip or spine, the ultrasound just can't penetrate effectively enough to trigger that response.
You can't reach the hip bone from the skin with enough juice to make a difference.
Correct. And you also have the issue of surface area. These wands are small. Treating a systemic issue like weak bones with a 5-centimeter wand is like trying to paint a house with a toothbrush.
Okay, that makes perfect sense. It works for a localized fracture line, not for a whole skeleton. So let's bring this all back to the listener who might be sitting on that exam table right now. They've got the gel on their knee. They're wondering if it's worth it. Based on this Physio Hub review, what is the verdict?
The verdict is that it is a supportive modality. That is the term they use, and I think it's perfect.
Supportive, meaning it's not the main event.
Not at all. Think of rehabilitation like building a house. You need a foundation, you need framing, electrical, plumbing. That's your active rehab, your exercises, your load management, your movement.
Okay.
Ultrasound is the coffee you drink while you build.
I like that. The coffee helps. It wakes you up. It makes the work feel a little easier, maybe gives you a bit of a boost. But the coffee doesn't build the house.
Precisely. If you just sit there and drink coffee all day, you end up with an empty lot and the jitters.
And this is the trap I think a lot of patients fall into. I've definitely been guilty of this. You go to TT, you get the massage, you get the ultrasound, it feels nice, and you think, great, I got treated.
But if you didn't do the squats or the stretches,
Then you didn't actually address the problem.
then you didn't do the work. The Physio Hub experts are absolutely adamant about this. If a patient is only getting passive treatments like ultrasound, they are missing the main driver of recovery.
So what's its best use case then?
Ultrasound can reduce pain, which opens up a window of opportunity. It settles the system down so you can do the exercises without gritting your teeth.
It paves the road so you can drive the car.
Yes, but you still have to get in the driver's seat.
I think that's such a crucial takeaway. It validates the skepticism. People feel like, is this just a massage? While also validating the science. No, it actually is stimulating cells. It's both. It's a tool, but it's not the magic wand.
And for the athletes listening, or people with those really stubborn injuries like a stress fracture, it's worth asking specifically about LIPUS.
Right.
If you have a non-union fracture, that technology is a potential game changer. And it's distinct from the standard rub and heat approach.
You know, spending this time unpacking mechanotransduction has actually left me with a pretty profound thought. We spend so much time in modern medicine focusing on chemistry. Pills, injections, IVs. It's all chemical intervention.
We are a chemically obsessed culture, for sure.
But we just spent the last 15 minutes talking about how an invisible force sound can physically flip a switch on a cell membrane and tell it to build a blood vessel. It blurs the line between physics and biology in a way I hadn't really considered before.
It really does. It reminds us that our bodies are responsive to the physical environment, to vibration, to light, to pressure, just as much as they are to chemistry.
It makes you wonder what's next,
Yeah.
If we can tune a sound wave to knit a bone, what other frequencies are we ignoring? What other invisible forces are out there that could act as keys to unlock our body's own repair kits?
It's a fascinating frontier. I think we are just scratching the surface of frequency medicine.
Well, the next time you see that cold gel coming towards you, you'll know exactly what's happening and what isn't under the surface. Thanks for diving deep with us.
Keep asking questions and keep moving.
Catch you on the next one.